hands.
Here's a buzzer for you. Anything
For your patient notes.
Otherwise, I'll be back with your medication.
Oh, thanks. So we have Miriam Adib. She's to be given PCA morphine for her post-fracture ribs. Yeah? Okay. I'll introduce myself. Hi Miriam. I'm one of the nurses looking after you today. My name is Nick. I'm a student nurse. So the doctor has ordered you PCA morphine for your post-fractured ribs. Before that, we need to confirm your identity. So what is your full name?
Mariam Adib,
Yep. What's your date of birth?
1719.
You mean 7 for the first 1969? Yep. So your MRN is 174963.
174.
And do you have any allergies?
No.
No? Okay, good. Before we administer the PCA, we just need to evaluate your pain. So out of 0 to 10, how would you rate your pain? From 10 the highest and 0 the lowest?
8.
8? Okay. And where is the pain that you're feeling?
In the ribs.
In the ribs? So how long have you felt that?
Last few hours.
Okay, so the cause of your pain was your fractured ribs. So after this, I'll check her obs and document it in here. Okay. Can you be my second RN to validate the medication order? To validate the order? So we have Miriam Adib.
Yeah.
MRN 174963.
Yeah.
She has no allergies. She's been ordered PCA morphine, 50 milligrams per 50 mils for her post-fractured ribs. The order has been signed and printed by the doctor. It is within date. So PCA morphine, concentration 1 milligram per 1 mil. Number of syringes is 3. PCA dose 1. Lockout interval 5 minutes. Basal infusion is 0. Hourly dose limit is 12 milligrams. The order has been signed by the doctor. She has also been ordered an antiemetic, so metoclopramide. Dose and route is 10 milligrams per IV. Interval is TDS. Signed by the doctor, and the date is within the correct date. She's also ordered naloxone for if she overdoses on morphine. So the dose is 0.2 milligrams via IV route. The interval is 2 to 3 minutes, and the order has been signed by the doctor, and it is within date. Okay, finish.
It's not with.
Yeah. So, the purpose of this medication is to provide you pain relief for your severe pain that you're feeling from your fractured ribs. Contraindications for morphine include severe asthma, severe bronchitis, respiratory depression, and opioid hypersensitivity. The dose to be given is 50 milligrams over 50 mils. And the adverse effects include respiratory depression, nausea, and constipation. So nursing considerations to look after Miriam Adib would be to check hourly vital signs, so her respiratory rate, her heart rate, her oxygen saturation, and full hourly temperature, and also to administer an antiemetic, which she's been ordered metoclopramide if she's experiencing any nausea, which is a side effect of morphine. So, clean hands. And now I'm going to gather my equipment. Here's one I prepared earlier. And cut. I'm gonna get Miriam's morphine out. Can you be my second RN to do the drug check and check the drug book? So we have Miriam Adib. She's been ordered the PCA morphine, 50 milligrams over 50 mils for a post-fractured ribs. She has no allergies. She's been given morphine sulfate. Morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate. 10 milligrams, 10 milligrams, 10 milligrams, 10 milligrams, 10 milligrams per 2 mils, per 2 mils, per 2 mils, per 2 mils, per 2 mils. 10 expires 10th of the 20, 10 of 20, 10 over 20, 10 over 20, 10 over 20. And over 2 mils. The date today is the 25th of the 5th, 17. Time is 10 o'clock. The patient's name is Miriam Adib. Amount to be given is 50 milligrams. So we have 5 ampules of morphine sulfate, 10 milligrams. 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 So they add up to 50 milligrams. Amount to be given. And expires 10/20, 10/20, 10/20, 10/20, 10/20. So we're taking 5, so the balance remaining is 0. The prescribing doctor is L. Hunt. Can you sign for me?
Yeah, sure.
Yeah. My second RN to do the first drug check. So we have sodium chloride, sodium chloride, sodium chloride, sodium chloride. Expires February 18, February 18, February 18, February 18. And they're 10 mils, 10 mils, 10 mils, 10 mils to equal 40 mils. So it's 40 mils within the 50 mils and 10. Okay, so here we have the 5 ampules of morphine. So morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate. 10 milligrams per 2 mil, 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 10 milligrams per 2 mil. Expiry 10/20, 10/20, 10/20, 10/20, 10/20, and it has not been given yet. Do you agree?
Yeah.
Okay, so I'm just going to draw up the medication.
button. When it is bright, you can press it, and it will deliver 5 ml of the medicine, and it has a long period of time. Within 5 minutes, you can't have another dose, but still you can have after 5 minutes. Whenever you have pain, you can just press the button. So when it will be commencing the medicine, it will flash the lights. So you can just press it.
Okay, stop. So can you confirm this? So in this syringe we have morphine, 50 milligrams, diluted with 40 mils of normal saline, and the concentration is 1 milligram per mil. Okay. What's the time? So 10, 10. So can you sign this? Okay. So can you be my second line for second drug check? So we have Miriam Adib. She's been ordered morphine, 50 milligrams in 50 mils for her post-fractured ribs. The order has been signed and printed by the doctor and is within date. She has no allergies. The dose concentration for morphine is 1 milligram in 1 mil. Number of syringes is 3. PCA dose 1. Lockout interval 5 minutes. Basal infusion 0. Hourly dose limit 12 milligrams. And it's been signed by the doctor. She's been also ordered an antiemetic, metoclopramide, dose 10 milligrams via IV route. In interval is TDS, signed by the doctor and is within date. She's been also ordered naloxone, dose 0.2 milligrams via IV route, interval 2 to 3 minutes, signed by the doctor and is within date. These are the morphine sulfates that I've withdrawn from. So 10 milligrams, 10 milligrams, 10 milligrams, 10 milligrams, 10 milligrams. Expires 10th of 20, 10th of 20, 10th of 20, 10th of 20, 10th of 20. Morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate. And they're each 2 mils, so 2 mils, 2 mils, 2 mils, 2 mils, 2 mils. I also used sodium chloride to agglutinin. So sodium chloride, sodium chloride, sodium chloride, sodium chloride. Expires February 2018, February 18, February 18, February 18. And 10 mils, 10 mils, 10 mils, 10 mils to make up 50 mils within this syringe. Yep. Morphine has not been given yet. And this is the syringe that was used. Oh. Yep. Okay. So just have to turn the line. Can you be my second RN?
Yeah.
So we have morphine, 1 milligram per 1 mil. So morphine, drug concentration is 1 milligram per 1 mil. 1 milligram per 1 mil. PCA dose is 1 milligram. Lockout period is 5 minutes. Occlusion 8. No continuous dose, so no basal infusion. Loading dose is 0. Max limit is 12 milligrams, so it needs to be changed. Okay, 12 milligrams. Limit duration is 1 hour. PCA delivery start. Okay. So can you be my second RN?
Yes.
So here we have Miriam Adib,
Okay.
MRN 174963, date of birth 7th of the 1st, 1969. She has no known allergies. She's been given morphine 50 milligrams in 50 mils for her post-fractured ribs. The order has been signed and printed by doctor and is within today's date. It has not been given yet. So the morphine is here. So morphine sulfate 10 milligrams per 2 mils, expiry date 10/20. Morphine sulfate 10 milligrams 2 mils, expiry 10/20. Morphine sulfate 10 milligrams 2 mils, expiry 10/20. Morphine sulfate 10 milligrams per 2 mils, expiry 10/20. Morphine sulfate 10 milligrams in 2 mils, expiry 10/20. And we use the sodium chloride diluent, so 40 mils altogether, so 0.9% sodium chloride, 10 mils, December 18 expiry. Sodium chloride 0.9% in 10 mils, December 18. Sodium chloride in 10 mils, December 18. Sodium chloride in 10 mils, December 18. And 1 milligram in 1 mil, morphine, PCA. Number of syringes is PCA dose is 1. Lockout interval 5 minutes. Basal infusion 0 milligrams per hour. Hourly dose limit 12 milligrams and has been signed and penned by the doctor. This is the morphine to be used. 50 milligrams in 50 ml. So morphine concentration is 1 milligram per 1 ml. PCA dose is 1 milligram. Lockout interval is 5 minutes. Continuous dose is 0. Loading dose is 0. And dose limit is 12 milligrams in 1 hour. And the dose rate is stat. and there's morphine sulfate, PCA, via IV. Do you agree?
Yes.
So it's BD plus the pack, so confirm syringe. And press start. Miriam, we're back with the morphine PCA. Before that, we need to confirm your identity. So, what is your name?
Mariam Adi,
Yep. MRN?
174963,
Yep. Date of birth?
7169.
Yep. So, do you have any allergies?
No?
No allergies? So, I can see from here. So, as you can see, there's no signs of infection. There's no swelling. Miriam, do you have any pain at your cannula site? No. When did you have it put in, the cannula? When did you have the cannula put in? Yesterday? Okay, so it's within 72 hours. Do you feel any pain at the cannula site? No? There's no redness? But, the cannula has no signs of infection. There's no redness. So you're good to go. My gloves. Have to wipe the cannula site. Okay. So, Miriam, the IV line used to give you morphine is a PCA machine. So, you just have to press this green button when it lights up. And once it lights up, you're able to press it and you'll hear a buzz noise like this. That means that the dose has been administered, and as the light flashes, it means that you're being given the dose. But once it stops, the green button will become dull, and you won't be able to administer a dose until it becomes light green again. So I'm just going to give this to you. Do you have any questions? No? Okay, so morphine can cause respiratory depression and nausea. So if that occurs, you just have to ring the buzzer and I'll come and provide you with some medication that will alleviate that, such as naloxone and metoclopramide. So I'm going to go, but I'll be back in 15 minutes to check up on you, okay? And then I'm going to finish my documentation, so Daisy. Just put away and do it.